Oh, sure. So the stages of breast cancer go from stage 0 up to stage 4. Stage 0 means that cancer is confined to the place where it started. So if it starts in the milk ducts, that's DCIS, ductal carcinoma in situ, or the situation or the place where it began. It did not break out of the duct yet. Stage 1 means it has broken out of the duct and has the possibility of spreading to other organs, but it hasn't spread to anything else, and it is a very small tumor with a very good prognosis and excellent survival. Stage 2 is still considered early stage breast cancer. It means the tumor is a little bit larger. It may have spread to one lymph node, but hasn't advanced throughout the body and throughout the breast and the armpit. Stage 3 is considered locally advanced breast cancer. It is now in the breast, it is present in the lymph nodes, and it's concerning for spread to other distant sites, which is stage 4. The reason we stage breast cancer this way is because it helps us to know, one, the survival. How long is your life going to be based on how early we find the cancer? And when we find it early, the survival is excellent. And based upon also the treatment. When we find breast cancers early, sometimes they are less likely to need more aggressive therapies like chemotherapy. The therapies for breast cancer are determined not just by the size and the location, but by the tumor's biology. So what I mean by that is we look for, on each cancer cell, we look for hormone receptors or stations to receive the signals from the body that tell new cancer cells and more cancer cells to grow. There are 3 hormone receptors. There's one for estrogen, one for progesterone, and a third called HER2. And these tell us what medicines a person might be eligible for based upon what's driving that cancer to grow. So HER2 positive cancers have to get a targeted medicine for that HER2 receptor. And that medicine means chemotherapy and then a targeted monoclonal antibody. So it can be a little bit confusing for patients because many times patients come to see me and they say, but my friend had stage 1 breast cancer and she didn't need chemotherapy. But it's based upon the tumor biology now more than ever. And that's very promising because it means we're trying not to over-treat people who have early stage disease, but it means we can be more targeted in our approach.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.